Cholesterol, a crucial type of fat, plays a key role in various bodily functions like cell membrane production, hormone synthesis, and digestion. However, elevated cholesterol levels can raise the risk of heart disease and stroke. Regularly monitoring your cholesterol levels and making necessary lifestyle adjustments is crucial. Welcome to our channel, where today we'll explore 6 indicators that may suggest high cholesterol levels. 1. Yellowish bumps around the eyes. Yellowish bumps around the eyes, also known as xanthelasma, may indicate high cholesterol levels. These bumps form due to the accumulation of cholesterol and other lipids beneath the skin. While they commonly appear on or around the eyelids, they can also manifest on other body parts like the elbows, knees, and hands. For some individuals, xanthelasma may raise cosmetic concerns, but it can also serve as a warning sign of underlying health issues such as high cholesterol levels or liver disease. If you observe such yellowish bumps, it's crucial to consult your doctor to identify the root cause and receive appropriate treatment. Your doctor may suggest lifestyle adjustments, medications, or other interventions to lower your cholesterol levels and mitigate the risk of heart disease and stroke. 2. Chest pain. Chest pain or angina is a prevalent indication of elevated cholesterol levels. Angina refers to chest pain that arises when the heart muscle doesn't receive an adequate supply of oxygen-rich blood. It may manifest as pressure or squeezing sensations in the chest and can radiate to the shoulders, arms, neck, jaw, or back. Angina episodes can be triggered by physical exertion or emotional stress and typically alleviate with rest. However, angina is a serious condition that can escalate into a heart attack if left untreated. If you experience chest pain or discomfort, it's crucial to seek immediate medical attention. Your doctor may conduct diagnostic tests such as a coronary angiogram or an electrocardiogram to ascertain the underlying cause. Treatment for angina may encompass lifestyle adjustments, medication, or surgical interventions, depending on the severity of the condition. Collaborating closely with your doctor is essential for managing symptoms effectively and minimizing the risk of complications. 3. Shortness of breath. Shortness of breath is another prevalent symptom associated with elevated cholesterol levels. When cholesterol accumulates in the arteries, it impedes the flow of oxygen-rich blood to the lungs, resulting in difficulty breathing. This symptom may become more apparent during physical exertion or while lying down. Shortness of breath can signify a potentially serious underlying condition such as heart disease or lung disease. If you experience sudden or severe shortness of breath, it's imperative to seek immediate medical attention. Your doctor may conduct diagnostic tests such as a chest X-ray or a pulmonary function test to pinpoint the cause of your symptoms. Treatment for shortness of breath will hinge on the underlying cause. If high cholesterol levels are contributing to your symptoms, your doctor may recommend lifestyle modifications like adopting a healthy diet and engaging in regular exercise to lower cholesterol levels. In some instances, medication may also be prescribed to reduce cholesterol levels and alleviate breathing difficulties. Close collaboration with your doctor is crucial for managing shortness of breath and minimizing the risk of complications. In certain cases, shortness of breath may indicate a life-threatening condition such as a heart attack or pulmonary embolism, underscoring the importance of seeking medical attention promptly if you experience this symptom. 4. Numbness or tingling in the hands or feet. Numbness or tingling sensations in the hands or feet may indicate elevated cholesterol levels. When cholesterol accumulates in the blood vessels, it can impede blood flow to the extremities, leading to nerve damage and these uncomfortable sensations. While numbness or tingling is often felt in the fingers or toes, it can also affect the hands or feet. However, these symptoms may also signal other underlying conditions such as diabetes or peripheral neuropathy. Seeking medical attention is crucial to determine the cause and receive appropriate treatment. Management of numbness or tingling in the hands or feet will be contingent on the underlying cause. If high cholesterol levels contribute to your symptoms, your doctor may advise lifestyle adjustments such as adopting a healthy diet and regular exercise to lower cholesterol levels. In some cases, medication may be prescribed to reduce cholesterol levels and enhance nerve function. 5. Swollen feet or ankles. Swollen feet or ankles may indicate elevated cholesterol levels. When cholesterol accumulates in the blood vessels, it hampers blood flow to the legs and feet, resulting in fluid retention and swelling. This symptom is often exacerbated after prolonged periods of standing or sitting and may be accompanied by sensations of heaviness or discomfort. Additionally, swollen feet or ankles can signal other underlying conditions such as heart or kidney problems. Seeking medical attention is essential to identify the cause and receive appropriate treatment. Management of swollen feet or ankles will be tailored to the underlying cause. If high cholesterol levels contribute to your symptoms, your doctor may recommend lifestyle modifications such as adopting a healthy diet and regular exercise to lower cholesterol levels. In certain instances, medication may be prescribed to reduce cholesterol levels and enhance circulation. 6. Fatigue or weakness. Fatigue or weakness may indicate elevated cholesterol levels. When cholesterol accumulates in the arteries, it restricts blood flow to the muscles, resulting in feelings of fatigue or weakness. These symptoms may become more pronounced during physical activity or after extended periods of inactivity. However, fatigue or weakness can also signal other underlying conditions such as anemia or thyroid problems. Seeking medical attention is crucial to ascertain the cause and receive appropriate treatment. Management of fatigue or weakness will be contingent on the underlying cause. If high cholesterol levels contribute to your symptoms, your doctor may recommend lifestyle modifications such as adopting a healthy diet and regular exercise to lower cholesterol levels. In some cases, medication may be prescribed to reduce cholesterol levels and enhance muscle function. It's important to note that many individuals with high cholesterol levels may not experience any symptoms. Hence, regular monitoring of cholesterol levels is essential, especially if you have a family history of heart disease or a stroke, are overweight or obese, have high blood pressure or diabetes, smoke, or lead a sedentary lifestyle. If you exhibit any of these symptoms or have risk factors for high cholesterol, consult your doctor about getting your cholesterol levels checked. Your doctor may recommend lifestyle adjustments such as adhering to a healthy diet, weight loss, regular exercise, and smoking cessation. In certain cases, medication may be necessary to lower cholesterol levels and reduce the risk of heart disease and stroke. In conclusion, high cholesterol levels can pose serious health risks, but many individuals may not experience symptoms. Therefore, regular monitoring of cholesterol levels and lifestyle adjustments, if necessary, are crucial for maintaining optimal health. If you experience any symptoms mentioned above or have risk factors for high cholesterol, consult your doctor promptly about getting your cholesterol levels checked. If you enjoyed watching this video, don't forget to like, subscribe and turn on the notification bell, so you don't miss any new videos. Let us know your thoughts about this video in the comments section down below and feel free to stay and enjoy it until the end. Also make sure to check out our next highlighted video and we will see you next time. Thanks for watching. Please like, share, and subscribe.